Welcome to Primary Care Conversations with Christine and Jeff, providing valuable and engaging pearls of wisdom on a broad range of topics relevant to your practice. Now join your hosts, Dr. Christine Palmay and Dr. Jeffrey Habert, as they guide you through the ever-evolving world of primary care.
Welcome to another episode of Primary Care Conversations with Christine and Jeff. I am freshly back from the Diabetes Canada meeting in Halifax. It was dreary and rainy, but a great meeting. And yes, please notice I do have a new background. Thank you. And please also notice that Christine and I, and our special guest Alissa, are all in the pink-red genre tonight, so we are sort of matching. I want to first welcome our special guest, Alissa Steinberg, who I've personally known since she was a young teenager. She is a registered dietitian and an Instagram personality with over 560,000 followers on Healthy You Dietitian. We're going to get to talk to Alissa in a second. First, I got to say hi to Christine because it's been a few weeks. How are you?
I'm great. And the only reason you prefaced the weather in Halifax is because right before that you were in Jamaica. So I am still a bit jealous.
Yeah, that was fun too.
No, I'm sure it was. Alissa, just delighted to meet you. This is actually our first venture into interviewing other experts, and you were top of mind. And I think, to be honest, top of season, because we are heading into the throes of celebratory season, where everybody is, planning huge dinners for whatever celebration they're happening. So I'm sure that this podcast will be quite timely.
Well, thank you so much for having me here.
We're really excited to have you and discuss our burning nutritional questions. We actually had so many nutritional questions, so we're going to try and get through a few of them. Christine, you talked about the holiday season, and I know we briefly mentioned about healthy treats for the holidays. Maybe we'll start off with that. Alissa, any quick ideas for keeping the holidays healthy?
So many. So it's definitely more damage control or just prevention kind of on my radar, my clinic. So just some tips and tricks would be to, when you're going to a family outing, bring that healthy dish if possible. I do a lot of talk around order of bites. So scan your kind of buffet family style meal and fill up your plate with all those free foods first. So the veggies, the fruits, the proteins. So it helps to guide healthier portions. Even kind of swap your favorite traditional recipes with some healthier ingredients. So kind of make a bit of a twist to those. And also everything in moderation, enjoy yourself and, give yourself a little bit of that kind of freedom to really be a part of that holiday venture and then just get back on track as fast as you're able.
So listen, one of the things that patients often mention is sort of the peer pressure from family members. Many of these holidays are cultural.
Yes.
And the language of love in so many cultures is eating, nanas, eat, fill your plate, etc. And, I found it a hard question to counsel patients on, how to approach, why aren't you eating, feeling as if they were almost disrespecting the host. Do you have any tips with respect to that?
Totally. So it's important to maintain those traditions, but a big part of that is still infusing your health goals if possible. And so sometimes it's a matter of, coming up with a recipe twist together and involving and cooking together and trying it out, and maybe even before the holiday, or just, managing your portions accordingly. So, enjoying that dish that might be a little bit heavier and add the other food groups to kind of balance it off. And again, it's really nice just to bring a healthy dish that supports your health goals. So at least you have something to kind of build on with your plate from that. So, but it's all about the balance. And I always say too, at the end of a really kind of heavier, kind of fun family meal, go for a walk, make it a part of your kind of new traditions, walk around the block, kind of just get that fresh air and some extra movement versus just kind of couch surfing thereafter.
Not so easy when we're, heading towards Canadian winter, but, point well taken. Do something after.
Or like,
afterwards.
Or like some snow angels. Yeah, exactly. Or even the next day. So building in kind of maybe a healthier routine thereafter that allows you to kind of balance out those meals.
One of the most common things we deal with in primary care certainly is the chronic disease of obesity. And
Mhm.
we're not going to talk so much about that today, but one of the most common questions that I get all the time is, oh my God, intermittent fasting, my friend lost 20 pounds.
Mhm.
So common. What do you say? Like, what do we say about intermittent fasting? Does it work? Is it healthy? Can they stay on it long term? What's a real story?
Yeah, so that's a great question. So there's a lot of buzz on that topic. It's important to note that intermittent fasting is all about when you should be eating, not necessarily what you should be eating. And research shows that whether both meta-analyses, systematic reviews, so really strong research has shown that intermittent fasting compared to just caloric reduction, about 10 to 20%, both have the same weight loss outcomes, about 7 to 8% over a period of 6 to 12 months. But intermittent fasting has some compelling or enticing kind of features where it kind of shifts your body into fast fat metabolism or fat burning, which is favorable for weight loss, insulin sensitivity, reduction of inflammation. However, here's kind of where my concerns are kind of raised. So research is really just in human studies is 6 months in duration. So that long-term piece of sustainability is missing and the impact as well. There's also newer research that those who are intermittent fasters are losing muscle mass by up to 10% of their lean body mass. Um, it's also an extreme eating pattern. So it does fall into that kind of yo-yo category because you're skipping meals and you're restricting all day, which could be linked to that feeling of failure and self-doubt. And 80% of people following those extreme diets do regain their weight after about a year. There's nutrient deficiencies because it's such a restricted time eating window. So you're missing the potential for, and not enough direction around what to eat. So there could be lacking in fiber, calcium, and other nutrients. And just really, it's just not for everyone, especially because it can actually raise cortisol or stress levels. So those with anxiety could be exacerbated, pregnancy, children, and especially those with a history of an eating disorder. So, and even as a parent, it's important to kind of understand your role as a food kind of role model in the home as well. So I'd say my takeaway from intermittent fasting is the magic isn't in the fasting. It's really the ideal eating schedule. So starting your day off with a balanced breakfast and finishing with an earlier dinner. So skipping that late night stacking and just finding that schedule that you can maintain consistently is the way to go.
Can we talk a bit about breakfast?
Yes.
And how it's underappreciated. And, my phenotype of my patient in the large part is sort of a perimenopausal woman. And I spent a lot of time talking about protein.
Mm-hmm.
Should I be talking about protein? I probably should be sending them to you, to be honest. But
Breakfast is my favorite topic, and you and I are on the exact same page. During menopause and perimenopause, nutrition is a big deal, and protein plays a starring role. So during menopause, our estrogen levels take that nosedive, and with that comes a cascade of changes. So we have a reduction in our muscle mass. So with estrogen dropping, women actually, the muscle protein synthesis also decreases. And so, for example, women lose about 3 to 8% of their muscle mass per decade after the age of 30, and all of that becomes accelerated during menopause. Bone density also declines. So the risk of osteoporosis spikes. So women lose up to 20% of their bone density within the first 5 to 7 years of menopause. Body composition shifts. So as women, we're more likely to accumulate fat storage around the abdomen, which increases our cardiometabolic risk. And lastly, we have a decrease in metabolic rate. So with the muscle loss and the increase in fat mass deposits, insulin sensitivity reducing, that altogether does decrease our metabolic rate by about 5 to 10% during menopause. But the good news is you can reverse all of these trends. So studies show that regular resistance exercise combined with a higher protein intake can actually halt the muscle and bone loss and even build it back. So yes, protein does become your best friend during menopause. So aiming for a little bit more than the guideline. So 1.2 to 1.6 grams per kilo of your body weight is the way to go. Space it out throughout the day. So my main recommendation is 30 grams of protein with breakfast and 20 to 30 grams for lunch and dinner. and about 10 to 15 grams of protein with our snacks consistently. Yeah.
So just a bit of a practical point. When I speak to a lot of my female patients, they say, by the time the end of the day comes, they've lost the ability to, really invest in meal planning. They have 101 other things to do. So would it be problematic if you uploaded your protein, say, breakfast and lunch? Or are you saying it's really essential to space it out?
I would say it is essential to space it out, mostly because there's a threshold in which our body utilizes a certain amount of protein.
Okay.
So we may actually not have optimal absorption if it's just at 1 or 2 eating timeframes. But it's all about just kind of hearing problem solving those very common problems is at the end of a long day, coming home, finding the energy to cook and prepare a meal or think about what to prepare becomes a challenge. So this is where I kind of dive into freezer meals, just building your meals around protein as opposed to here's my pasta dish. And then you're thinking about the others. So start with the protein and just keeping it super simple. My favorite are sheet pan meals, slow cookers. So coming up with some solutions to help make that happen.
And probably planning in advance.
Yes.
I mean, it's amazing.
Yes. Yeah.
All right. Just saying, ladies, I just love breakfast. I won't tell you where I go for breakfast most days, but I love breakfast.
It starts with the Tim and ends with the
Yes, it
Hortons.
starts with the Tims. That's very good, Christine.
No judgment. They
we
have egg
hear-
white bites. The egg white bites at Tim's are
I know,
amazing.
but why bother? Why bother? Life is too short. Coming back from Halifax, we talk a lot about this cardiometabolic story now. I mean, liver, kidneys, heart. But what about these cardiometabolic diets, Mediterranean diets? Do they help? Is it worth it?
Okay, so I would say yes. So I feel like the Mediterranean diet is like the Taylor Swift of cardiometabolic health. So it's timeless, universally praised, and totally worth the hype. This isn't just a trendy diet. It's one of the most researched dietary patterns out there. So it's not a rigid meal plan. It's kind of an eating menu inspired by traditional cuisines from countries bordering the Mediterranean Sea. So Italy, Spain, France, Greece, Turkey. And research has shown that the Mediterranean diet can actually reduce your cardiovascular risk by 30%, improves your lipid profile, associated with lowering your systolic blood pressure, 5 to 10% loss of body weight after 12 months, so it has that long-term ability to maintain the adherence, decreased risk, decreased inflammatory markers, diversity in your gut microbiome. So the list goes on in terms of all of the benefits with the Mediterranean. So it's the powerhouse of prevention and treatment. So in terms of what it actually consists of, I'm happy to share with you kind of ideas on how to kind of integrate concepts into your menus, even at Tim Hortons.
Absolutely, go ahead.
Okay.
Okay, let's hear some.
So in terms of just being able, so the whole pattern is based on whole, less processed ingredients. So it's really kind of minimizing those refined starches. So minimizing white flour, added sugars. It's skipping the packaged processed foods. And the foundation really is about getting more vegetables, fruits, whole grains, so low glycemic index starches, and lots of legumes and plant-based proteins. It's really saying the principal fat should be extra virgin olive oil and dairy in moderation, red meat occasionally, and the flavor really should be coming from herbs and spices, lemon and garlic. So my main suggestion to get this started is not to switch the culture in the cuisine and the culture in your home, but integrate these principles into your menu. So for example, instead of using butter, switch to olive oil, or swap your rice at times for quinoa or some buckwheat. Transform your favorite packaged snack like granola bars into something homemade with whole ingredients, or even take your favorite recipe such as a chicken curry and ramp it up with more veggies and even add a legume to it as well. So it's really kind of the Mediterranean triangle pattern, the biggest base. It's all about kind of taking that base and building your meals and your snacks around that volume. So this goes back to that plate method. It's my favorite plate. I bring it everywhere I go. So taking the concepts of the Mediterranean diet, that's the base of the triangle, load up on your vegetables and fruit being half your plate, a quarter of your plate being whole grain starches that are low glycemic index. So sweet potato instead of white potato, sourdough bread instead of the white flours, and even things like farro, buckwheat, and bulgur, and kind of experiment with those. And then with that protein quarter of our plate section, it should be a balance of both lean and lean proteins, so chicken, eggs, and fish, as well as the plant-based proteins taking kind of the lead, the center stage of those proteins, so nuts and seeds, soy products, so tofu, and legumes as well.
That was great because we talked about all that. Christine, we probably have time for one last question, so let's give it to you.
Just diet fads along that trend. Paleo.
Yeah. So I really do like a lot of the concepts of paleo because, again, it goes back to whole ingredients, less processed ingredients. So it kind of follows a similar philosophy to the Mediterranean diet. But again, it's all about an eating pattern that you can maintain long term. So once you kind of learn about all the different kind of high quality patterns, which one resonates the most with you that you can sustain long term? So it's very similar to the Mediterranean diet with those whole, less processed ingredients.
Okay. Maybe I'll ask one last one before we wrap it up, because all our practices, Christine and I, our practices are aging, mine more than hers. Any quick advice for our elderly patients, our elderly relatives?
Yes. Okay.
In terms of healthy diets?
Yeah. I'd say my top nutrition recommendations would be to prioritize protein. So there's a lot of muscle loss from sarcopenia that happens naturally with age. So ramp up that protein intake above the guidelines to about 1.2 to 1.5 grams per kilo. Hydration. Older adults have reduced sense of thirst. So prioritizing and at risk for dehydration, especially things, and it could really contribute to worsening of fatigue, confusion, even falls. So just small sips of fluid throughout the day. Calorie and nutrient density. So appetites are also reducing. So I say use energy dense foods and make every bite count. So I call them golden bites. So using things like nuts and seeds, topping up your meals and your snacks with some oil and some cheese, guacamole. So really healthy kind of fats as a part of the menu. So there's more calories per bite. Digestive health and fiber. So constipation also is something to think about. So prioritizing fiber, about 25 to 30 grams throughout the day, combined with hydration helps kind of the digestive flow. And lastly, looking at the micronutrient support. So things like calcium and vitamin D for bone health and prevention of potential fractures. B12, iron, and folate are key. B12, there's less absorption as we age. So sometimes supplementation, but again, prioritizing things like chicken, eggs, and fish can give you that B12, but there is that decreased absorption. And if there is deficiencies, make sure to address them. But it's also so important to look for the signs of malnutrition. So really kind of be a bit more of kind of an early detection kind of focus. So unexplained weight loss or loose clothes that are fitting a bit looser. Poor wound healing. So if you're not healing as fast or more infections, it can be connected to nutritional status. Fatigue, weakness, or loss of appetite. Difficulty chewing or swallowing. And lastly, just that community and social connection. If there's more isolation, there's that risk of not eating as much because we all enjoy eating when we're together and that appetite does actually elevate.
Okay, that's amazing. All right, you know what? I'll hand it back to Christine in a second, but let me just wrap it up by saying thank you so much, Alissa. You guys can all follow Alissa on Healthy You Dietitian. And I forgot to mention, Alyssa's about to publish a book on nutrition and menopause, so we should all look out for that. Christine, I'll hand it over to you to wrap us up.
Well, you have to send me the link to where to pre-order the book, number one. And number two, I think that this has just been marvelous. I could have asked you 101 questions. But one of the things that came through is the concept of being involved in your food.
Yeah.
So we mentioned, cooking for joint dinners during the holidays. We mentioned meal planning, the Mediterranean diet, avoiding pre-made processed foods. Jeff, you're allowed to go to Tim Hortons only if you change the way you order, but
the egg white bites.
Egg white bites. But I think it's about, we've lost our relationship with the preparation of food, appreciation for ingredients. And, it's such a simple concept. And in busy lives, hard to actually invoke.
I never really had a relationship with my preparation for food, but in any case.
Well, it's all
There's
about
always time.
the low-hanging fruit. So any small change does
Yeah.
account to more over time. So starting slow and also giving yourself credit for that is key. So I'm a bit of a cheerleader. No matter what change you make, it all counts towards kind of being a healthier you.
All right. That's great. Thank you, guys. This was so much fun.
Oh,
Alissa, once again, it was so much fun to have you. Thank you. Everyone have a happy holidays. We will probably record our next episode before the end of the year, but stay tuned. We still have to determine the topic. Anyway, thank you, everyone. It was so much
Yeah.
fun. Alyssa,
Thank you
a
so much for
million
having me
times.
here and taking the time to chat. You're both incredible. So thank you.
Thanks, guys.
good night.
Good night, everyone.